Friends from the media, good morning. Welcome to today's 11 a.m. anti-epidemic media briefing. We have with us the Chief Executive as well as the Secretary for Civil Service. The Chief Executive and the Secretary will be delivering open remarks, and then the floor will be open for questions. And please, meanwhile, observe social distancing and wear a mask here. Chief Executive, friends from the media, Hong Kong citizens, good morning. This morning, I have with me the Secretary for Civil Service, who is in charge of a vaccination program. And we will be giving you a report on the progress of a vaccination rollout. And on the 11th of March, 2 weeks ago, we reported the progress to you. So it's been a while, and I'd like to further report our progress. I believe we have been stressing the importance of vaccination, and I've appealed to the media that in your reporting you should help us emphasize this main point. Vaccination is the most effective means of safeguarding public health, and this is beyond dispute. Whether it be the death cases in the fifth wave of the epidemic and overseas experience we can give this same conclusion. Vaccination can help reduce deaths and severe cases. Vaccination is also the most effective way of protecting our healthcare system. Third point, vaccination is our way out of the epidemic. And may I venture to say that it is a prerequisite of resuming quarantine-free travel with the mainland and opening up our boundary with the rest of the world. Now, Mr. Nip will be giving you details of the vaccination program. So I'd just like to repeat that all along we rely on scientific evidence in implementing vaccination program. In relation to the priority groups for vaccination, the number of jabs to be received, and the intervals between the first, second, and the third jabs, we've consulted the relevant experts and advisors. Since the start of our vaccination program, we have had advice given by various expert groups, and I'd like to express my gratitude. First of all, we have a committee, and that is the Expert Committee on COVID-19 Vaccination, led by Professor Lau Chak-sing. We also have another Expert Committee on Assessment of COVID-19 related incidents, jointly chaired or convened by Dr. Ivan Hong and Dr. Li Chai-ken. And we also have a joint scientific committee that is comprising the Scientific Committee on Prevention of Communicable Diseases, chaired by Lau Yulong, and also another committee on zoonotic diseases. These experts have been giving us expert advice in the past 2 years, and every time after a meeting has been convened by one of these committees, the government will issue press releases through the Information Services Department's websites, and also the Food and Health Department's and Health Protection's websites. We let the public know about their expert advice because we need transparency when it comes to the vaccination program. And meanwhile, we also make use of social media platforms such as Facebook and other social media channels. I'm grateful to them. In fact, yesterday afternoon, I had a meeting with the various chairmen I mentioned, as well as the 3 experts, and we discussed this issue, and that is under the current environment, how we can further boost the vaccination rate. Since the end of February last year, it's been almost 400 days since the start of the vaccination program. We are never want of vaccines at any time. We have 2 types of vaccines in Hong Kong. We have Sinovac and BioNTech, and we've always had sufficient community treatment centers as well as vaccination outreach teams. So for members of the public who have yet to be vaccinated, in particular the elderly population and children, and also members of the public not yet receiving the third jab, you should get jabbed as soon as possible. I'll defer to the Secretary for Civil Service to give you more details. Thank you, Chief Executive. Good morning, friends from the media and Hong Kong citizens. I'd like to report on the progress of the vaccination program and also our follow-up work. First, something about the statistics. As of last night, we already administered 14.9 million doses of vaccine for people above the age of 12. 6.18 million already received the first jab, and that is 92% of the population. Taking into account children between 3 and 11 years old, that's 310,000 receiving the first jab. Altogether, we have 6.5 million in our population receiving the first jab, and that is 89.5%. As for the second jab, 5.64 million already received the second jab, 84.12% of our population. As for the third jab, 2.67 million of our population already received the third jab. And starting from the 21st of March, for those above the age of 18, after receiving the second jab, they can receive the third jab 3 months after. So taking this age group as the basis, over 55% of them have already received the third jab. For elderly population above the age of 60, for those who already received 2 jabs 3 months ago, now for this age group, the vaccination rate is close to 70%. We have 313,000 children between the age of 3 and 11 receiving the jab. The vaccination rate is 59.5%. We have targets for the vaccination rate. For the population above the age of 12, we target a 90% vaccination rate for the second jab, and also for youths, elderly people above the age of 70, and also residents in residential care homes, we seek to boost the vaccination rates for them as well. Although the epidemic situation seems to be stabilizing, we have yet to observe a clear decline. And statistics from the 5th wave of the epidemic are telling us a clear fact. The death rate for the unvaccinated far exceeds those who have been vaccinated. Over 90% of the deceased in the 5th wave of the epidemic did not receive any vaccine or did not complete the 2-jab program. The vaccination rate for those with 2 doses are 18 times lower than those who never received any vaccine jab or only received 1 jab. So vaccination is the only way and the most effective way of leading us out of the epidemic. Since January, we have increased the number of community vaccination centers to 18. Some private operators have been lending us their venues for free, and we also have offices, car parks, and sites under construction being converted. And we also have 4 containers or 4 mobile stations set up, together with the help from private doctors and district organizations. We have been increasing the capacity of outreach teams, and we're able to administer 100,000 jabs per day. In the past 7 days, the average jabs administered were only 60,000. So we have more vaccines than those who are being vaccinated. We'll continue with our work. Apart from making sure that vaccines are readily available, we also need to make sure that we place focus on the elderly. We understand that for some elderly people and the disabled, because of mobility issues, they may not be able to visit our community vaccination centers. So together with healthcare organizations and social welfare organizations, we'll be making a joint effort to further enhance the vaccination rate. The Hong Kong Council of Social Services earlier, together with the Medical Association of Hong Kong, implemented a pilot and conducted home visits to disabled and elderly residents and provided vaccine jabs. And we'll continue with this pilot. This experience helps us to further expand the community vaccination program so that more elderly residents and disabled residents can receive the jab in the community, in their homes. We'll continue to focus on 2 areas.
First, we are going to establish an online platform so that who need to get vaccinated can register through this platform. They can give us the particulars, including address, so can we arrange for the service. And the relevant team, healthcare team, will also be organized in such a way that they can go to different districts and go to pay home visits for vaccination purposes. This online platform will be set up within this week, put on a trial basis, so that for those who are paying home visits to elderly people, they would try to find out how many of them will require vaccination and how many of them are not able to do this because of disability or other healthcare problems. And then we will launch this scheme fully later on. Everyone can get registered through this platform so that we can arrange a home vaccination service. And this week we are going to try out a new measure. And that is when we do the compulsory testing, the RTD in some housing estates or some buildings, we would at the same time of doing this provide the service, that is the registration service, to those who are over 70 or who are disabled. And then after the buildings are opened up again, we will arrange a home visit the next day for vaccination. And also, if we have got data that there are more certain buildings are more at risk, we will make sure that the elderly residents there will be protected by vaccination as soon as possible. Actually, in previous RTD service, we already provided sampling taking through home visits. So there are residents that we know that cannot get vaccinated because of their problems. We would now to provide the vaccination service the day after the RTD is over. We would learn from this experience, improve the home visit program for vaccination, including manpower deployment, the delivery of jabs, the observation period to be observed, as well as the arrangement for outreach teams to get to them. So may I remind members of the public that if they have elderly family members who can really go to a vaccination center or to a mobile vaccination, when they should do this without waiting, because the earlier they get vaccinated, the better protected their family members are. On the 18th of March, we already reached the first stage of our objective, and that is we would cover 1,100 RCHEs and homes for the disabled for the vaccination of at least the first dose, so that we can have the coverage we want. We have set ourselves the second stage objective, and that is we'll arrange our outreach teams or doctors to do this within the coming 3 weeks, and that is before the 15th of April. We would arrange at least 2 rounds of visits to the 1,100 homes for the administration of the second jabs or to administer the first one if they haven't been given any. As at the 24th of March, for 43,300 residents of these homes have been vaccinated through our outreach teams or have been given the jabs in our centers. The vaccination rate is now 56%. For some residents of these homes, they may want to get by BioNTech vaccines. We have arranged outreach teams to do this. This has already begun. Children is another major group that we would like to protect. We would like to strive for getting the vaccination rate for those in the age group of 3 to 11 to a new level. We have arranged with the Education Bureau, the PTAs, and principals associations to arrange for a variety of channels for vaccination service. Apart from private doctors, and they can also make group appointments so that their students can go to a community vaccination center or to the student health center operated by the Department of Health to get vaccinated. Or alternatively, they can have outreach teams going to the schools to provide the vaccination to students and their parents. Well, it's already the 395th day of the pandemic. We have learned a hard lesson. It has shown us that vaccination is very important to protect our health. I sincerely urge everyone, civil servants, doctors, healthcare workers, and everyone to support the vaccination program. This is key to our program to combat the epidemic. Everyone should get the vaccinations to protect Hong Kong and our population. We now have a Q&A session. Please raise your hand. When your name is called, please tell us your organization, and then we'll give you the microphone. The middle one with a laptop.
So on the flight suspension...
sorry, could you speak louder, please? Sorry.
So on this flight suspension mechanism, what's the rationale behind shortening the suspension period from 14 to 7, as opposed to lowering the threshold of the number of positive cases on each flight? Why not simply cancel the mechanism as just suggested by experts and other industry representatives? And did you communicate this to the airlines, and what was the feedback? For the 9 countries, we're still not seeing a lot of flights being resumed, and we're told this route-specific suspension is a deterrent. So do you think the lowering of the ban to 7 days is good enough? And how will you make sure the changes do not increase the risk of transmission in the community? And for the death rate, now we have more than 7,100 deaths in Hong Kong. Who in the government do you think should help accountable for this state of affairs? And who should bear responsibility? And could these deaths have been avoidable? Thank you.
I cannot comprehend your last part. Can you repeat that?
So now we have more than 7,100 deaths in Hong Kong. Who in the government do you think should help accountable for this state of affairs? Who should bear responsibility? Could these deaths have been avoidable? Thank you.
Of the 3 questions, first of all, I have been asked several times on this occasion since the announcement on Monday about lifting the place-specific flight suspension. The questions revolved around whether we could also look at the route-specific flight suspension. And I said that there is no room for major relaxation because ultimately the purpose is still to ensure that we could implement effectively the policy to prevent the importation of cases into Hong Kong. This remains a fundamental pillar to Hong Kong's anti-epidemic policy. I have to make it very clear. But having considered the latest epidemic situation and the difficulties caused to Hong Kong residents who are stranded in the 9 countries for almost 3 months now, the government considers it timely and necessary, having considered their situation, to lift the ban in respect of these 9 countries. But it doesn't mean that we will loosen all the necessary anti-epidemic controls as far as importation of cases is concerned. That's why this route-specific flight suspension policy or measure has to continue. At the same time, if you look at the press release issued by the Food and Health Bureau last night, we are also imposing a lot of requirements for pre-boarding. In other words, those Hong Kong residents who wish to come back, they still have to fulfill all those requirements before they could board the plane to come back. And similarly, the airlines, as the operator of those inbound flights, they also have to comply with the various requirements. For example, checking the PCR negative test of the passengers, make sure that they have the booking at least 7 nights in a designated quarantine hotel before they allow these passengers to board the plane to come to Hong Kong. So since we have this expectation and requirement of the airlines, we need to put in some penalty. If they fail to fulfill these requirements, and bring a certain number of infected passengers into Hong Kong, then we have to take some punitive action so that they would do better. So I said that there's no room for major relaxation. So what we announced last night could be described as a streamlining of the existing arrangements. But the most crucial control feature is the number of 3. So any inbound flight that brings in more than 3 or more passengers who are tested positive upon arrival, then they will be subject to this route-specific flight suspension. The other changes are more streamlining and adjustments in nature. The most important thing is we stick to every flight. You can't bring in more than 3 infected cases to Hong Kong. Now, whether this will increase risk, there will be a certain degree of risk. So in public health control, most of the measures are a balancing of the risk and efforts to manage the risk in order to enable the city to continue, in order to address the social and development needs of Hong Kong and the individual circumstances of our people. We couldn't be too harsh with our people, and the people's tolerance has always been one of the factors that we need to consider in devising the best public health measure for Hong Kong. But if I could give you some figures, the risks, as I see it, will be manageable. One is, if you look at the whole of February, the rate of inbound passengers who were tested positive upon arrival was 0.76%. And for the month of March up to the 23rd, the rate was slightly higher, it was 1.1%. So if more passengers are coming back, so in absolute numbers there may be more, but we believe that these percentages, when compared to the Hong Kong current infection situation, should be manageable. And the second factor is because all these infected inbound passengers, the great majority were asymptomatic or with very mild symptoms. So although they were tested positive via PCR tests upon arrival, very few, or actually none, would need to be admitted into HA hospital. They could be transferred immediately to a CIF hotel, that is a community isolation facility hotel, for isolation until the test results turn negative, then they could be discharged. So the second worry about overburdening Hong Kong's public hospitals and hence affecting the hospital's capacity to treat acute or very critical patients, again, subsides. So the government's considerations is a very careful and balanced one. Whether we have communicated to airline, I suppose after announcement and even somewhat before announcement, the Transport and Housing Bureau should have talked to the airlines, but we will never be able to meet the aspirations and needs of the aviation industry in full because they are doing a business. of course, they would not like any limitations or restrictions on how they should conduct a business. But we are in a public health emergency. So every business has to make sacrifices. The catering industry has been making a lot of sacrifices. Those CAP 599F scheduled premises have been making a lot of sacrifices because of the government's mandatory closure of their premises. So I hope and I make an appeal that airlines will also understand that we are striking a needed balance to allow some inbound flights to take place, but at the same time, we will not relax our controls in order to keep Hong Kong safe. Everyone in Hong Kong, including, of course, myself and my team, are very saddened by the number of deaths that we have seen in this fifth wave. And that's why we have tried every effort and every means to address the situation. Together with the very good advice we were given by the mainland experts, our strategy now is really to focus on the treatment side. And the first priority has been given to the elderly. And hence, yesterday, together with the Secretary for Labor and Welfare, we talked about how to take better care of the elderly. We set up a task group under the Labor and Welfare Bureau in order to ensure more effective communication and optimal utilization of the holding center and the various facilities that we have set up. And today, the Secretary for Civil Service is urging people to receive the vaccination so that we could protect our elderly better. Thank you.
下一位記者嘅提問。
Next reporter. This reporter in a brown top. Good morning, Chief Executive. I am from Hong Kong 01. I have a number of questions. First, earlier you mentioned that whether you could not decide whether we should coexist with the virus or adopting the dynamic zero strategy. And then in a subsequent media interview, you maintained that the policy should be achieving dynamic zero infection. Is it upon the central authorities' instruction that you maintain this version so that you could resume quarantine-free travel with the mainland? In February, when there was exponential growth of confirmed cases, you stated that the CUT, compulsory universal testing, will be conducted in mid-March. And now you said that the best time is still to be explored. Do you agree that you have in fact passed a wrong judgment on the right time for the CUT? And now we have over 7,000 people dying of COVID in the fifth wave, and even columnists and pro-establishment camp criticized the government's strategy. Do you think that is the government's blunder? Do you think that the government has a main responsibility? And are you going to apologize to the Hong Kong people, especially families of the deceased?
I said earlier that the community should not be asked to argue over the two different routes that we might take. And we have different understandings of what these two routes mean. I hope everyone will be practical and support the SAR government in finding the most effective program to fight the epidemic in Hong Kong. And every city adopts different measures and strategies. We have seen in recent days that Shanghai has adopted a new way of fighting the epidemic, and we have 2 years of experience. We have been trying to find the best way of doing this in Hong Kong. But this is a dynamic situation. The epidemic is changing all the time. With the we found the first Omicron case on the 31st of December, and then we suppressed the spread of this variant. But unfortunately, at a later stage, we had a problem with a case in a isolation hotel. a person that was infected by another patient nearer the time of completion of the isolation period. But that's something we cannot totally prevent or rule out in fighting the epidemic of this nature, since it's highly transmittable and mobility in the community was still very high. Therefore, we will have to look at the situation every now and then and make an assessment of what we should be done, and we will have the advice of our experts, both locally and from elsewhere. If we make changes, it's for the purpose of fighting the epidemic, not just because someone has changed his or her mind. I hope people can understand this. And in regard to the community-wide testing, we always believe that timing is the of the paramount importance. No one expected that after February we had such an outbreak. The peak was on the 3rd or 4th of March. If we did not tell people that we are trying to refining the details and we were trying to get support from the central government, if we didn't do that and make an announcement later, people would blame us for not telling them that we had a plan like that. But we need to look at the capacity. We have to ensure that we have the capacity to carry it out. Otherwise, just empty talk. I think the day before yesterday, we were talking about distributing the essential packs to fight the epidemic. Again, we had to consider the capacity to make the deliveries. We have mobilized 5,000 to 10,000 volunteers to help us, and we have to do the packaging intensely so that we can give every one of the 3 million recipients a pack. So in this process, we have been doing our utmost to ensure that we do really shoulder the principled responsibility to fight the epidemic, which is what we are trying to do day in and day out. And we have been trying to make amendments and make improvements, which you may think is an adjustment of not just the measures but the policy. What we are trying to do is to make sure that we can emerge from the epidemic as early as possible. The lady at the front. I'm from Hong Kong Economic Journal. 2 questions. You said earlier that you have an open mind about setting up a review committee on the epidemic. It's been rumored that you would like to get someone internally to head the review committee. But with the purview so high for the review committee, would you not considering appointing a judge or someone independent to chair the review? And it's been said that Hong Kong has the insufficient community capacity so that we cannot do the community-wide testing as we like. But has it got anything to do with the disqualification of district council members so that we have a diminished capacity as a result? It's been announced that under the Labour and Welfare Bureau, there will be a task force set up for this purpose. But now people are criticizing us that we are trying to use a working group within the Labour and Welfare Bureau to take the place of the review that we would like to have for the epidemic as a whole. But the LWB, the working group, would be looking at the elderly residents and the service and isolation of elderly homes residents. We know there's room for improvement in some of our elderly homes. We need to make improvements, especially perhaps, for example, the ventilation. Therefore, we have a interdepartmental working group set out, headed by the Permanent Secretary for Labour and Welfare, so as to look at the subjects related to the elderly residents and confirmed cases among the elderly residents of these homes. So we would like to get these people affected by the epidemic to go to the holding center direct instead of going to the A&E department first. And if an elderly resident is confirmed with the infection, do they need to go to one or two convalescence hospitals or centers before they are transferred to the holding center that they need? I've asked the Labour and Welfare Department, Labour and Welfare Bureau to look into this and make better arrangements. But this will not take the place of the review committee that we talked about earlier. Well, this is a major public health risk involving quite a large number of deaths. This is a major incident. I want to send my condolences to every bereaved families. And I've said that the review can cover a wide range of topics, including our healthcare system, our welfare system, our public health system, and the interaction of these systems, and whether the coordination and linkage are organized in an effective manner, and also the fact that we have a cluster system in the hospital authority. Is it the best arrangement to deal with an epidemic? Well, I believe in this particular case, a dedicated hospital network will be better. And I have personally dealt with several cases of review committees. And if you want me to come up with the terms of reference for this particular review committee in question, I would say that the purview will be very wide. But now the epidemic is still in progress, and I cannot say for sure that it will be over very soon. So as the chief executive, I don't think we should divert our attention to the work of the review committee. I believe the next term government will certainly look into this. If they want me to give them advice on how this can be done, I'm very glad to do so. And as for the lack of sufficient community capacity, it's the opinion of the mainland expert. And I have to agree with him. You can see that in Shanghai, in other mainland cities, they can mobilize the testing and the isolation measures very quickly. And I don't think Hong Kong can copy this. It's not what an individual, the electoral members or district council member can help. So I don't think this because of the changes to our district councils and that we had the capacity and now we don't.
Next question. This lady reporter over here. I'm from Cable. Good morning. Professor Gabriel Leung today said that for major mainland cities, the epidemic is emerging, and it is really difficult for allowing Hong Kong people to return to the mainland whilst the epidemic situation in Hong Kong is still severe, and we should understand the country's needs and not to stir up trouble. What is your view on that? About the 2 oral medication available in Hong Kong, there are suggestions that the healthcare system is too cautious in dispensing oral medication. Now, for holding centers, the usage rate is low, and there are also elderly patients being transferred from one facility to another with very low efficiency. You just mentioned that outreach teams would be established to help jab elderly who are staying at home. May I know more about the whole procedure? For example, after administering a jab, the person is supposed to rest for 15 minutes, and will the nursing team stay behind and observe for 15 minutes? And if that is the case, wouldn't it cause a slowdown of the whole process? I'll answer the first two questions, and then Mr. Nip can say more about the vaccination arrangement. Now, I didn't actually personally listen to Gabriel's remarks, but let me say this. In some mainland cities, we are seeing outbreaks. And at the time, I said that the difference in Hong Kong is that every time in the mainland when there is an outbreak, such as Wuhan, the mainland attaches great importance to preventing importation of cases, as well as preventing cases from spreading to other cities. So in early 2020, there were indeed passengers from Wuhan or Hubei causing some cases to be imported into Hong Kong. We have not ever had similar cases. I actually checked the figures this morning. Although we have kept 599C and other arrangements allowing people from the mainland to come back to Hong Kong, and I'm saying Hong Kong residents in the mainland returning to Hong Kong, we have not let in any risk. So under the return to Hong Kong scheme and come to Hong Kong scheme, they can return home safely. And like I stressed just now, we must not casually relax these measures, because there is no other country as responsible as ours in preventing the export of cases. So when there is an outbreak in Shenzhen, our neighboring city, we have to be responsible as well. This is exactly the attitude we have in protecting our country. Now, I said that as long as the Guangdong provincial government and Shenzhen municipal government deemed fit, and that Hong Kong government should adopt measures to prevent exportation of cases, then the Hong Kong SAR government definitely will be willing to support them. For example, we have originally 8,000 cross-boundary truck drivers, and we have substantially reduced the number of cross-boundary vehicles. Instead, we rely on water transport in maintaining supplies to Hong Kong. We also require cross-boundary vehicle drivers to go through all these tests, such as PCR and RAT, before they're allowed across the border. And we also have transfer yachts, so that mainland drivers can come all the way to the yachts in Hong Kong for the transfer of consignment. It will be done in a closed-loop manner, and similarly, a closed-loop arrangement is put in place for cross-boundary drivers. This is one way of safeguarding the country's public health whilst maintaining overall safety, and we're willing to implement all the suggested strategies. Now, in fact, last night we issued a number of press releases starting from the 29th of March. For passengers traveling by air to the mainland or Macau at the Hong Kong International Airport, they are required to observe another requirement. Apart from a PCR negative result taken 2 days before or 48 hours before departure, at the time when they reach the airport for a flight to the mainland, they are also required to go through a rapid PCR test. So that means they could have arrived at the airport 2 or 3 hours before departure. Now they need to be there 6 hours before. Now, this creates inconvenience to Hong Kong residents, but then we are responsible for preventing exportation of cases to the mainland. The Hong Kong SAR government arranges for free this rapid PCR test at the airport, so that passengers can take this test for free before boarding the flight. In this way, we can prevent exporting more cases to the mainland. In fact, on the 21st of March, we already implemented this arrangement at land border checkpoints. But then on the 29th of March, we started to implement the same arrangement for passengers traveling to the mainland by air. So that means the Hong Kong SAR government is taking responsibility. The other question, we have stressed a number of times that we have 2 antiviral oral medication for COVID-19, and we've stressed that we have procured a sufficient quantity. And I have told the hospital authority many times that doctors at the clinics can be more relaxed in dispensing this oral medication, because according to experts, the most effective period when the oral medication should be administered is during the first few days of onset. Now, that means perhaps the patient has yet to be admitted to hospital. Perhaps the patient is still residing in the residential care home, or perhaps the home environment is such that he is receiving isolation at home. And also, a patient may be transferred from a residential care home to a holding center because of his rather stable condition. That means for all these access points, the oral medication can be dispensed. However, we cannot just freely distribute the drugs for use. You must at least visit a doctor's clinic. I would only say that we have a number of, rather extensive outlet network. And we have also lowered the criteria for dispensing the drug. For example, for elderly below under the age of 60, immunocompromised elderly patients, they are all suitable users of the drug. In fact, yesterday, when I discussed with the experts, I consulted the number of experts on this anti-epidemic strategy. That is Dr. Ivan Hong and Professor David Hui. I asked if we're to further procure oral medication, which should I go for, the MSD one or the Pfizer one? And they offered me some advice. And we also have ample facilities available. That means the public should be reassured. If somebody tests positive, whether he's deemed by the CHP to be suitable for being sent to an isolation facility, or, for example, the person wishes to be sent to a community isolation facility upon testing RAT positive, we have everything ready. We have designated transport, and we have the community isolation facilities available. Now, you see, we are placing people first, as you can see in all the video clips. The disciplined services and the bureau chief are constantly pondering how we can make it more convenient for confinees in the community isolation facilities. For example, the subject can even bring the carer along, because we have, say, rather spacious rooms with more than one bed in some of the facilities. Our purpose is for the infected to be isolated as soon as possible. So I appeal to anyone who tests positive either by PCR or by RAT. You can check your home environment and check your health condition and other circumstances. And if you want to be isolated at one of the facilities, please contact us and go to one of these facilities as soon as possible, and also join hands in fighting the epidemic.
Well, the problem of passing the elderly patient around from facility to facility, well, that's why I have asked the Secretary for Labour and Welfare to steer the review. And that precisely because we want to prevent a situation whereby the elderly patient has to be transferred from one location to another, because every time it will involve loading and boarding and getting off and also commuting. If the condition of the patient is stable, then the patient should be transferred out of an elderly home and to a facility that we have built. We have so many holding centers now. Likewise, if the patient is already in a designated hospital dealing with the immediate problems, and the doctor is of the opinion that the patient can be discharged or can be transferred to a holding center for better care, so that the patient can get the service in a suitable facility instead of being returned to the elderly home right away. I'll ask the Secretary for Civil Service to supplement. The vaccination program for the elderly is one of our main priorities. We are talking particularly about those with mobility problems who are over 70 or who are disabled. We will provide the outreach service to their homes to provide the vaccination with community organizations and private practitioners who are willing to help us with this. As I've said, the Hong Kong CSS and the Medical Association of Hong Kong have been doing this through trial schemes, and some other community organizations are trying to do the same. So this home vaccination service, we would like to reach out to more elderly people and disabled people in their homes. On the part of the SAR government, we will be doing the coordination centrally. First, we will provide the online platform so that we can know where they are, where they live, so that we can organize the service. And then when they go out to pay the visits, they know how many there are, how many service recipients there are in a particular housing estate, and they can provide the vaccination service accordingly. Secondly, we will arrange for healthcare service teams, including those from private doctors, nurses, volunteers, who are eager to help. We organize them and deploy them to do the outreach service under the vaccination program. And the SAR government has to do the coordination to make this possible, so that the coverage would be wide and we can cover as many elderly people as possible. Because this is more complicated than doing the outreach service in the residential homes for the elderly or for the disabled. We are talking about home visits. We need to deploy our outreach teams, healthcare workers to provide the jabs. We need to arrange for the right number of vaccines and the workflow of delivery. We have to make sure that the recipients are suitable and there's no allergy problems. The nurses may be administering the jabs. The doctors involved may not have to go from a unit to another one in the housing estate, but he or she must be accessible and provide the oversight. And then there should be an observation period after vaccination, and if there is any issue or problem, we have to make sure that it can be dealt with immediately. And after doing this, we provide the vaccination record to those who have been vaccinated. All of these are details we need to flesh out. We are now working on this. We have learned from past experience. So we are determined to do a good job. It's complicated, but it can be achieved. So we are targeting, as I have said, those who are over 70 years of age, who have not been vaccinated. We hope that we can reach out to their homes. But for elderly people who can go to a vaccination center themselves or to a mobile vaccination point themselves, please do so. Because after three months after getting the second jab, you can get a third jab. We have more than 4 million people who are eligible. We've just covered 2.6 million so far. So more than 2 million people are due for the third jab. So time is of the essence. Get vaccinated soon. We have the capacity to administer 100,000 doses a day, but now we are just doing 60,000. So we are waiting for more people to come forward. If there is in the future another major outbreak, then more people will be rushing to the vaccination points, and then we will be overwhelmed. And then we are going to get many serious cases. So I advise everyone not to wait. Please get vaccinated soon. This is the end of today's press conference. See you tomorrow. Thank you.